On the Medical Watch, a lifelong career making a difference in medicine.
And medical reporter Dina Bair introduces us to the CT man.
He spent nearly 4 decades designing CT machines. They aid in cancer diagnosis, pinpointing bone injuries and heart and lung ailments. And in the pandemic, they were critical for COVID patients. But when the engineer became the patient, his work took on a whole new meaning.
As this whole element rotates, the camera takes multiple pictures.
What's inside a CT machine? A really good camera.
One picture at this position, it rotates.
Bob Senzig knows the technology inside and out. The engineer who spent 36 years at GE Healthcare gave us a peek under the hood of the million-dollar machines that look deep inside the body.
Now, as the patient moves through, it's sliced like this on the digital side, and you can put that together and make a 3D image and see the entire image rotate.
But last November, he got a different view of the system he helped design. Lying flat on his back, his lungs the subject of an emergency imaging study. The 66-year-old had COVID.
There's no good explanation as to why I am still here and 700,000 other people are dead. I made the mistake of agreeing to go on vacation. And so I thought, well, I'm going to try to be as safe as I can. So I went and had a COVID test, and it was negative, and I thought, hey, I'm good to go.
His symptoms surfaced even before he landed.
And then I got a pounding headache. It was so bad.
Soon he was having trouble breathing. Bob went to a local hospital. His blood oxygen levels dangerously low.
I'm pretty sick. I can't think very well. I'm going into a scanner. I really wondered, what CT am I going to see here? And it was a Brightspeed, which is one that I helped develop, and so it was nice to see that. Yeah, this is all the parts depot here, where all the parts are assembled here.
His body of work is lined up at the Waukesha, Wisconsin manufacturing facility.
On this particular machine, I worked a lot on the detector and the overall system design and some of the specs and things on the tube.
A CT relies on precision and speed.
The first system I worked on, it was 4 seconds per revolution. Now the scanners are 0.23 seconds, so it's so quick. Yeah, so think about that camera going blink, 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 taking shots.
In Mexico, Bob's condition spiraled. He reached out to a colleague to help him arrange a medical flight back to the United States.
I called him up and I said, you got to get me out of Mexico or I'm going to die here.
In order to be transferred safely, Bob had to be intubated. That's his last memory before going on a ventilator.
This is the start of the line here.
Thousands of COVID patients have undergone CT scans to help doctors determine damage and a course of action. It's been a critical tool during the pandemic.
My lungs, when I saw them on the CT scanner later, they were just totally engulfed in COVID pneumonia. I don't know how I was possibly breathing.
Bob was ultimately flown to an Arizona hospital where his care team attempted to wean him off the ventilator.
I'd be there in my memory, I would just be going, and thinking to myself, I'm going to die here.
After 4 weeks, he was finally ready to breathe and speak on his own.
Merry Christmas, Mom. Merry Christmas, Barb, and all the rest of my family.
Why does it hit one person more than another? And it's just a gamble, if you get it, that you might end up in the same condition that I was in.
It's been a year now, and Bob still has shortness of breath. His most recent scan, taken on another CT he helped design, shows the lingering damage.
I've always felt that, the healthcare, and that's why I stayed here for 36 years, is so rewarding to work on something that is helping people. But I didn't think that in the pandemic that it would be such a big deal, but it has been.
I'll say. Bob's friends, family, and former GE colleagues rallied around him, helping to raise funds for the $25,000 air ambulance ride back to the United States. Back to you.